Hi everyone, it's Liz, the Frugal Libertarian, and I thought I would do a video on my neurological problem because it's something I've been asked about online, I've been asked about in real life, and I thought just having a video out there that would explain it more would be really, I guess, helpful. I have a neurological condition called pudendal neuralgia. Your pudendal nerve runs from your tailbone up through the inside of your hips and out onto the tops of your legs. It contributes to bowel control, it contributes to reproductive functioning, and it contributes to your ability to just be able to walk. What I have wrong with me is both neuralgia and entrapment. I have a massive scar tissue around my nerve. This condition tends to be a male-dominated condition. It's extremely rare, but the majority of the people who have it are men. And the women who have it usually get it from childbirth. I had it before childbirth. We don't know where the scar tissue came from. I was a horseback rider. That sometimes they say horseback riders and bike riders are the two that get this, the two main activities that can contribute to this problem. But having the scar tissue on the nerve like it is, basically it constantly causes the nerve to fire, to scream, help, there's something wrong, help, there's something wrong, because according to the nerve, there is something wrong. There's, you know, there's a scar tissue sitting on it. Why isn't this getting fixed? So it pretty much 24 hours a day is screaming at me that there's something wrong. And it's been this way for over a decade. It's been this way for almost 15 years. But also because scar tissue doesn't move, when that nerve gets stretched, usually through some kind of activity, it causes additional pain because the nerve tries to stretch out and it can't, because where the scar tissue is, the scar won't move, so the nerve pulls against the scar and kind of increases the signaling, because then it starts to really scream, there's something wrong, there's something wrong. So I kind of have both. One of the worst parts of this is the activity restriction. Like I said, I was a horseback rider. I trained horses. I worked at horse farms. I had horses growing up. I did pony club when I was in high school and middle school, and it was a huge part of my life. I used to do, horse shows and things like that, and that is one of the things you can't do. The list, put it this way, the list of exercises you can't do is so gigantic that it's easier to say the things you can do, which are two things. Walking on a flat surface, meaning a flat treadmill, walking around a track, that kind of thing, which is hard to do around here, especially in the winter. My entire neighborhood is hilly. Our driveway is hilly. There's no way that I can just go walking around and it'll be flat. So there's that. And then the other activity is actually swimming, which I'm not a good swimmer, and again, don't really have access to an indoor pool, and most of the year you can't use a pool in Connecticut. So activity level way down. One of my favorite things to do was yoga. I used to do it every single day. That is one of the worst activities for this type of problem, because especially, I mean, even I was like, well, I can keep doing it, I just won't use the hip openers, because hip openers immediately tug the nerve and cause additional pain. Pretty much you can't. There's nothing you can do in it that won't cause additional pain. I am on a myriad of medications, everything ranging from pain management to anti-inflammatories, muscle relaxants, anti-seizure drugs, things like that, because basically trying to stop the nerve from telling my brain that it's in pain. I used to go in 2 to 4 times a year and get nerve blocks done, because that would significantly lower the pain. We're talking drop it by at least half. Since my son was born, I've had them and they don't do anything. So I'm waiting to go and get another MRI done of this nerve to see what has changed since my son was born. The insurance I had was not letting me go get this done. I have new insurance and now I can go. I'm just waiting on the doctor to send the orders in. And yes, this is something that this is not just one of those like, well, we don't know what's wrong with you, so we'll call it that kind of illnesses. This is actually, went into New York City to the hospital for special surgery, went into the 3T MRI machine and got an MRI done, and they located the scar. That's why I'm referring to it so specifically, because we actually had a test done that found this. That saw damage to the nerve, saw the scar, and it is what it is. So this is actually something that's been verified. A lot of people with pudendal entrapment can get it fixed relatively easily because it's usually entrapped, stuck in you know, between bone. It's being pinched by something like that, and they can get it fixed real easily. Usually when people have a mass of scar tissue somewhere in their body, it's easy to treat as well because they can either go in surgically and cut it out, or they can dissolve it with chemicals. Here's the problem. The scar is actually on my nerve. If you surgically remove it, you're going to cut the nerve. Severing the nerve might end the pain. I would lose bowel control. I could lose the ability to walk. It's not an acceptable alternative. And likewise, dissolving the scar with chemicals would damage the nerve. So basically, exactly same situation. It's not a viable option. There aren't a lot of treatments for this. Like I said, it's incredibly rare. Incredibly rare. There's the National Organization of Rare Disorders. I believe that's their words, but it's NORD, N-O-R-D. They specifically keep track of rare illnesses and keep, you know, reference information for doctors and for patients about these rare conditions. They don't have anything on it because it's too rare for them to keep track of, which to me sounds kind of crazy, but they don't keep track of it. And literally there is nothing other than what we're doing. There is no other option. There isn't. And it's not one of those things that'll go away with physical therapy. It's not something that'll go away with surgery or anything. There's very limited options. I also have another issue since my son was born. Like I said, the pain is not treatable anymore and there's something else going on. We don't know what it is. Then also I'm having neurological issues all over my body. My hands tremor like crazy. I have really bad short-term memory loss. I drop things. My fingers don't respond to my brain telling them to do things. So I'm actually going into the neurologist to see what's going on with that. Chronic pain, like I already experienced, is unbelievably disabling. Like, really, really disabling. A lot of people lump chronic pain patients in with drug addicts because they say, well, the pain is in your head. You think you need these drugs and you don't. If you were, all you need to do is go to rehab or detox or something like that and get you off of these drugs and you'd be fine. Really? Like, no. There was somebody had said once, which I thought was really apt, is that for an addict, pain management therapy, you know, pain medications, for an addict, they destroy their life. And I know that firsthand because somebody in my family died of an overdose, an accidental overdose of illegally obtained pills. So to the addict, it destroys their life. But for the chronic pain patient, it gives you your life back. And that's the real truth of it. That's the difference. When I either don't have medicine or the pain gets so bad that the medicine isn't helping, I'm on the couch. I am unable to control the pain. It is like searing, burning, cutting pain. You know, and I've heard other people say, you know, chronic pain is such a joke. These people are wimps. You know, I had surgery and I only took my meds for like a day and then I didn't need them anymore. You don't need them. And the thing is, what we feel is not what we feel every day is how you felt that day, the first day after surgery, when you needed the meds. You stopping taking your meds had nothing to do with you being a strong person. It had to do with the fact that your body started to heal. So your pain started to diminish. My body will never heal. So for me, I will never get to that point where I'm saying, oh, my body feels better. That's, again, the difference. People assume because, you know, I had knee replacement, I had back surgery, I had, in the case of somebody I know, a brain tumor removed, I didn't need my drugs after like a couple of days. That you don't need them. Really. Again, your body's healing. Mine can't heal because according to my body, it's healed. You know, to my body, scar tissue is perfectly natural. It's what the body does. You know, your body at any given moment has random bits of scar tissue all over it. From this injury, that injury, or just because. And, you know, it's not going to heal that because it's what it's supposed to do. That's what it is. It already did. It's not going to heal away a scar because the scar is healing to the body. Mine just happened to get tangled or attached. I don't even know. We don't know how or where, but it got onto the nerve and there's nothing that can be done about it. There are things lifestyle-wise that can decrease the pain. Mostly avoiding like allergen kind of things. Anything that would further irritate the area is to be avoided. I have to use special toilet paper. I have to use a special wash. Probably TMI, most of the time, and I mean the majority of the time, I don't wear underwear. You know, I try not to be like I am right now, sitting for too long. I can't drive for more than about 20 minutes. 30 minutes is my max. And if I go over 30, I'm looking at a day on the couch from the pain. So there are some things I can do to lower the risk of having what we call flare-ups, which is where everything around it just starts getting so irritated that the nerve just screams bloody murder. It yells all the time, but sometimes it absolutely screams. And I could do whatever I can to avoid that. Now, me being pregnant with this illness was sort of a medical unicorn because everybody kind of looked at me like, first of all, nobody, like most of the doctors have never heard of this. My doctor knows about it because he's my specialist. I had 2 different doctors kind of watching over me. No, I'm wrong. I had 3 different doctors watching over me while I was pregnant because they didn't know what to expect. And the fact that I went into preterm labor could have been the nerve malfunctioning because that was one of the biggest concerns was, will the nerve respond properly? Will it not? Does it know, you know, what to do? Is it just gonna, would I just never ever go into labor because it just wouldn't work? Would it, or would it do what happened? You know, could it have caused, you know, malfunctioning of it caused me to go into preterm labor? That's a possibility too. And like I said, there was a majority of the women that have this got it from vaginal delivery. So that was why I was scheduled for a cesarean anyway, because they were going, we don't want to mess with the scar. We don't want to make it worse. We don't want to, do anything to it. We're just going to avoid it completely. Hopefully you never go to labor and this won't be a problem. And then I went into preterm labor. My son was almost delivered, and it did cause all of the problems that we were trying to prevent. But yes, that's the condition that's wrong with me. And like I said, I've got some other stuff going on, so you can't see that my hands are tremoring right now. Which hopefully, soon I'll have tests done to see what's going on now. That's when I talk about, I have disabling neurological problems. That's what I'm talking about. This nerve problem is what I'm talking about. So anyway, I will talk to you soon with more topic videos. Just thought I'd get this one out of the way. I've reshot this like 4 or 5 times now. And every time I shoot it and then I go to edit it and I don't like it. So maybe I'll like this one. We'll wait and see. If you haven't already done so, please hit subscribe, and I will talk to you later. Have an awesome day. Bye.